Hello, today I'm going to talk to you about eating disorders. Eating disorders are not just about food, these are complex mental health conditions that require the intervention of medical and psychological experts. There are six types of eating disorders, and I will talk to you in brief of every one of them. The very first one is anorexia nervosa. It is generally develops during adolescence among young adults, and it affects more of women than men. People with anorexia view themselves as being overweight. If they are very dangerously overweight, they tend to constantly monitor their weight and avoid eating certain types of foods, and even severely restrict their calories. Common symptoms of anorexia include being considerably underweight, despite the fact that they are less compared to people of similar age. They have got very restricted eating patterns, and apart from that, they have an intense fear of gaining weight or persistent behaviors to avoid gaining weight. They have a relentless pursuit of thinness and an unwillingness to maintain healthy diet. There's a heavy influence of body weight or perceived on self-esteem. They have a distorted body image, including denial, as I've discussed with you previously, if being seriously underweight. There are two types of anorexia: the restricting type and the binge type and the purging type. The second disorder of eating is bulimia. Bulimia nervosa, it occurs also in early adolescence. It is less common among men than women. Usually both girls with bulimia usually eat very large amounts of food in a specific amount of time. So it is when, let's for example, it's dinner or lunch, they eat a very large amount of food until it becomes painfully full and they have pain. During the binge, the person usually feels they cannot stop eating and control. And it can happen with any type of food, but most particularly occurs with foods which the individual may normally avoid. Individuals with bulimia tend to purge to compensate for the calories consumed and relieve gut discomfort. Um, Common purging behaviors include, they do forced vomiting, fasting, laxatives, diuretics, enemas, and excessive exercise. Symptoms may appear very similar to those of binge eating or purge eating of anorexia nervosa. However, here the individuals usually maintain a regularly normal weight rather than becoming underweight. The common symptoms are recurring symptoms of binge eating and recurrent episodes of inappropriate purging behaviors like, inducing vomiting, a self-esteem which is influenced body shape and weight, and a fear of gaining weight despite having normal weight. Now here, what is here important is the side effects which are very common, which I've seen in my clinic. There's an inflamed sore throat, swollen salivary glands, worn teeth, enamel, tooth decay, acid reflux, irritation of the gut, and severe dehydration. In severe cases, it can cause an imbalance in the electrolysis, and the patient can end up having a stroke or heart attack. So, in summary, what do people do with bulimia? They eat large amounts of food in short amounts of time. They fear gaining weight despite having a normal weight. The third disorder which I want to discuss with you is the binge eating disorder. In this, it begins in adolescence. Patients of disorder are similar to those of bulimia. They usually eat unusually large amounts of food in relatively short periods of time and feel a lack of control by binges. Common systems: they eat large amounts of food rapidly in secret and uncomfortably, like no one is watching. They feel a lack of control during episodes of binge eating and feeling of distress, like they feel shame, disgust, or guilt when they're eating. They're feeling very shameful. They use no positive behaviors such as vomiting or excess exercise or laxatives or diuretics. People with binge eating disorders often have overweight or obesity. They may have the increase of getting complications like heart disease, stroke. In summary, people with binge eating disorders regularly control and incredibly consume large amounts of food in short periods of time. Unlike people of other disorders, they do not purge, that is, not induce vomiting. Then you've got the fourth disorder, which is called pica, which is very common. common among pregnant women. What they do is they involve eating things which are not considered food. Individuals with PICA crave non-food substances like ice, dirt, soil, chalk, soap, paper, hair, pebbles, laundry detergent, or cornstarch. It occurs, like I said, in adolescents, pregnant women, and also in individuals with certain mental disability. Now, individuals with PICA are at an increased risk of poisoning, infection, gut injuries, and nutritional deficiencies. However, to be considered PICA, the eating of non-food substances must not be a normal part of this culturology. In addition, it must not be considered a socially acceptable practice by the persons peers by society. In summary, individuals with PICA tend to crave and eat non-food substances. This it affects particularly pregnant women and individuals with mental disorders. And finally, there is a very newly organized disorder which is called rumination disorder. This involves a condition where the person regurgitates the food they have previously eaten, swallows it and rechews it, and then swallows it. It keeps on swallowing it, rechewing it, swallows it, rechewing it, yeah, and spitting it out. I have not seen any of them. I've just read about it. It occurs mainly during infancy, childhood, or adulthood, and it disappears on its own. Children and adults with this condition usually require therapy to resolve it. Adults normally may restrict the amount of food they eat, especially in public. This may lead to losing weight and becoming underweight. In conclusion, rumination disorders can affect people of all stages and generally regurgitate the food they have swallowed, then they chew it again and then swallow it or spit it out. And finally, there's the avoidant or restrictive food disorder. This is a food disorder which is found it develops in early childhood and it can go into what happens. It is equally distributed among men and women. Individuals with the disorder they experience disturbing eating during a lack of interest in eating certain foods, smells, tastes, colors, textures, or temperatures. Common symptoms of avoidant resistance, the avoidation of restriction of food, eating disorders that interfere with normal social functions such as eating with others. And it is important to note that it goes beyond normal behavior such as picky eating in toddlers or lower level food in adults. In addition to this, there are other similar in other eating disorders apart from these 6 ones which I've discussed, which are very rare. There's purging disorder, there's night eating disorder when people wake up in the middle of the night and they want to frequently eat excessively during the night. They get up from sleep and they start doing eating. And other unspecified, there are very many of these which are noticed. The bottom line, what I would like to say is that eating disorders, these are mental health conditions which require treatment. They can be damaged if left untreated for the patient. If you have any questions, ladies and gentlemen, please feel I would be more than willing to hear them, and if you can, let me know by subscribing to or you can subscribing to this video, or you can even call me on 07876855034, or you can check my website rajivshori.com. Till next time, have a nice day, ladies and gentlemen.